Hello, everyone, and welcome to this audio podcast. Synopsis, is part of a Phantom edition. This audio podcast, Synopsis, is part of a Vertex Roulet. This audio podcast, Synopsis, as part of a Lobostics Machina. And this audio podcast, Synopsis, as part of a Storm Lobostics production. In this audio podcast, there will be in this audio podcast sort of series or edition, there will be a look at varying research poster presentations and works looking works from sort of research poster presentations presented at the Royal College of Pediatrics and Child Health in 2022, the American Society of Nephrology in 2022, a UK Kidney Week 2022, and research poster presentations presented at the International Pediatric Transplantation Society, International Pediatric Transplantation Association 2022. And so, as part of this synopsis, to provide a bit of a backdrop or some background to these research poster presentations, and wherein wherein there will be sort of audio podcasts that in this edition that will go into each of these poster presentations in a bit more from a bit more sort of perspectives. But to begin with, just as part of this synopsis, the poster presentation looking at coping in young people with chronic kidney disease (CKD), and wherein the poster presentation was was presented again at the Royal College of Pediatrics and Child Health in 2022, and wherein this works was a retrospective overview, and wherein the original works, peer reviewed and published works, was works presented. It was peer reviewed and published in around 2015 and 16, and where the aims and objectives of the investigation was where the team where the collaborative works sought to identify and understand sort of coping strategies in two cohorts of young people aged 12 to 18 years, and in two cohorts of young people aged between 12 and 18 years, wherein one cohort being those a cohort with a cohort of young people suffering with CKD, chronic kidney disease, and within the CKD stages 4 to 5, 4 to 5, or the severity 4 to 5, and a cohort of young healthy people, by comparison, were also within the sort of same age range, and where in the two cohorts there were amongst the two cohorts there was a process of interviewing to understand again understand and sort of identify coping strategies, and wherein the research team looked to identify to also sort of delve into the construct, if you like, about and look about a about a specific a specific question, looking at a specific question in regard to what coping strategies do young people adapt to enable them to cope. In the research poster presentation itself, there is a basis in around a bit of a sort of an intro and backgrounds, a look into some of the methodology, a look at some of the sort of theoretical framework or basis, and then wherein there is a sort of a look at several different several different themes as part of analysis, and then as part of several different themes as part of the analysis, and then some aspects in regard to implications for clinical practice in context of pediatric nephrology. And then following on from this poster presentation as part of this series, as part of this additional series, there's a look at works that was presented at the American Society of Nephrology in 2022, and one of the collaborative works was a look at looking at chronic kidney disease, and looking at chronic kidney disease and the sort of educational sort of practices and wherein aligned to sort of more aligned to sort of more recent peer-reviewed and published works. There were the poster presentation looks at sort of a qualitative inquiry to understand sort of perspectives from patients, those suffering, those who are suffering and going through varying stages of chronic kidney disease, and healthcare, and varying sort of healthcare professionals amongst between three cohorts, four cohorts of participants, including the patients, to understand how patients and professionals see a sense of more mutual efforts to see works to see healthcare services for patients and carers, etc., to see healthcare services for patients and carers, and see healthcare services sort of bettered between sort of the physical spaces through and following sort of consultations that might take place in sort of clinical environs, albeit in sort of primary care services or secondary care services, and also in amongst sort of the online space, between sort of through the use of sort of informational healthcare informational websites, and also through sort of social media spaces and sort of social media platforms. This poster presentation was collaborative between academia, and also between two social media platforms. And the poster presentation looks at some of the qualitative data overview in and as part of this collaborative works. The poster presentation also highlights a little bit in around some of the some of the ways in which patients and professionals can see a sort of a effort in around sort of more joined up care, wherein sort of documented documented communications, for example, can be linked into electronic patient records, and through a sort of through a schematic, a sort of a schematic that is part of the poster present as part of the poster presentation. And then in this edition, there is works that was presented. There was works sort of presented at the UK Kidney Week, looking at sort of a review of pathology and analysis of approaches to easing to easing kidney disease or renal disease burden, and where this where the poster presentation provides an overview. The poster presentation provides an overview in regard to the link between the sort of biomedical visualization and biomedical visualization of the sort of the pathogen detriments in regard to the adenovirus, once exasperated and prompted exasperated, thus to cause and thus where adenovirus then sort of develops into the subset of virus linked to COVID-19 or SARS-CoV-1 and SARS-CoV-2. The poster presentation looks at it looks at sort of a biomedical visualization of SARS-CoV-1 and SARS-CoV-2, and then looks at sort of an organ crosstalk between organ crosstalk and sort of biomedical communication in regards to the immunological pathway in regard to SARS-CoV-1 and CoV-2, and also delves into sort of delves into aspects of laboratory practices in regard to varying sort of procedures that look to support and ensure those who are sort of suspect or at risk of SARS or CoV-1 or SARS or CoV-2 can look to ensure that the applicable laboratory procedures or practices are in place, are utilized to ensure patient care. To ensure patient care, the poster presentation that was presented at UK Kidney Week 2022 or UKKW 2022 also looks at sort of the renal or nephrology and COVID correlation. The nephrology or renal correlation, which has not been so much sort of public domain, unfortunately. Unfortunately, and despite where, for example, one of the mechanisms to ensure for example, there's applicable blood flow through the applicable blood flow through, for example, the renal through our renal arteries, such as the efferent and afferent arterioles. That the poster presentation delves into how understanding the renin angiotensin aldosterone system or pathway, and in aligned to the role of ACE or angiotensin converting enzyme 2, or enzyme 2 and enzyme 2 inhibitors, and how potentially that the pathway can and should be could be sort of investigated in more detail, in more detail, or in such a way that where wherein the presentation looks at sort of the principles of ACE2 in context of immunology and infection, to understand the burden around kidney disease. Within the poster presentation, there is an overview in regard to the visualization of molecular action during COVID-19 or CoV-2 infection, and then the poster presentation draws on some particular sort of conclusions. Then, as part of this sort of series, there is a look at works works presented at the International Pediatric Transplantation Association, or IPTA, in 2022, and there are specifically two or three research poster presentations that were presented, and in one of the IPNA IPTA IPTA 2022 poster presentation, research poster presentation. There was a look at transplant immunobiology, and looking at transplant immunobiology in context surrounding a chronic kidney disease, linked to a chronic kidney disease review, or CKD review. And there is a look at sort of the literature, wherein varying literature sort of retrospectively look at sort of the pathway, but look at the varying pathways of linked to immunobiology, and sort of the linked to the pathways in regard to sort of the physiology the physiology in around the renal sort of system. And the research poster presentation sort of focuses the literature in aligned to sort of sort of the principal actions surrounding sort of chemokine and chemokine receptors being sort of the main markers in part of immunological sort of pathways, and also a look at the literature around some literature in regard to and across specialties aligned to physiology, thus to also link, for example, to link sort of transplant immunobiology and sort of neuroendocrinology, as part of this as part of this collaborative research poster presentation from 2022 at the International Pediatric Transplantation Association, and then a second research poster presentation at the International Pediatric Transplantation Association, or IPTA 2022, looks at works focusing on transplant neuroimmunobiology, and looking at specifically around transplant aspects around transplant rejection, and also a sort of a retrospective on neuro on sort of the immune again sort of parts of the immune part of the parts of the immunology, and also parts of where neuroendocrine processes are linked. The research poster presentation has a looks into a schematic in regard to the biology of chemokines and chemokine receptors, and looks at chemokines and receptors that have been evidenced and identified in varying sort of laboratory investigations in line to human renal acute allograft rejection, and the poster presentation also delves into some of the literature and sort of the sort of evidence works from varying investigators. The research poster presentation also delves into some view on prospective, potentially prospective investigations for investigators to be in sort of in view or in view of, or in of intrigue. And there is then some there are some within this poster presentation. There are then some conclusions, in forming part of this, forming part of the sort of latter parts of this sort of presented works. And then finally, in this series, there is a look at a poster presentation, a poster presentation in link to sort of using the internet and online methods for data collection, and the works focuses on focuses on literature aligned to sort of data aligned to research and works wherein investigators in amongst and across varying specialties have sought to utilize the internet and the World Wide Web, for example, to sort of involve participants with varying conditions, varying conditions in amongst different sort of healthcare specialties, to understand to understand how aspects of healthcare and healthcare service can be sort of can be sort can be sort of made better in context of those sort of specialties. And the poster presentation was has sort of a look at has sort of a look at a sort of no a look at sort of five different themes, and looks at looks at also looks at sort of the advantages, some of the some of the advantages of traditional sort of ways of having participants involved in works versus sort of online methodologies. And in particular, the poster presentation focuses on sort of the on focuses on the sort of the focus focus group entity versus a focus group entity, rather than the sort of one to one sort of the sort more so than the one to one perspective, owing to where investigators and researchers, when looking to understand aspects of healthcare services in context of varying specialties, look to involve participants in sort of in a sense of a cohort, rather than a one to one in the majority of published works. And so this poster presentation, again presented at this research poster presentation presented at the International Pediatric Transplantation Association, or IPTA, in 2022. Then draws on some conclusions in regard to a review on sort of the use of the internet and online methods for data collection. That draws this audio podcast synopsis to a close. This audio podcast synopsis is part of a phantom edition. This audio podcast is part of a Vertex Roulet. This audio podcast as part of a Lobostics Machina, and this audio podcast as part of a Storm Lobostics production.